Well, bravo for that good work. Our next speaker is Leslie Gordon. Her topic is the role of community programs, City Harvest. Leslie is the Senior Director of Program and Strategy Operations at City Harvest. Welcome to the podium.
Good morning. Thank you, Susan. We are delighted as City Harvest and frankly honored to be in your company for the last 2 days. I wanted to give a special thank you to the Planning Committee and most especially Robert Post for thinking of us. We're delighted to be here with you today. So contextually, I'm going to take you through who we are as an organization, share with you a bit of background about our landscape, particularly as it relates to seniors in New York City, and then it'll be super fun to walk you through our Healthy Neighborhoods program. So just really quickly who we are at City Harvest. We've been in the marketplace in New York City for over 30 plus years, founded in 1982. We're the world's first and New York City's only food rescue organization. We're dedicated to feeding New York City's hungry by collecting excess that would otherwise go to waste and distributing it to those in need. It comes from food manufacturers, wholesalers, supermarkets, corporate cafeterias, farms, you name it. We're a member of Feeding America, for those of you who are familiar with that organization. We delivered our 500 millionth pound last year. Our first year, we delivered about 1 million pounds of food. We have a 45,000 square foot warehouse in Long Island City, New York, that opened up in 2011, and it's given us a really magnificent capability to move more food than ever before. We're on pace to deliver to hungry New Yorkers about 60 million pounds this year of good, nutritious food. I'll tell you that even our food waste doesn't go to waste, so we work with an organization in New York City called Build It Green, and they come get our waste that produces compost and that's used in city community gardens. Our fleet of 22 refrigerated trucks, including 2 tractor trailers, is on the road as we speak and has been since early this morning. Travels about 275,000 miles a year crisscrossing New York City, or for those folks who like data, it's about 8 times or more around the equator. Pretty cool, right? We do this all for free. Everything that you'll hear me talk about today, City Harvest does free of charge. We're the beneficiaries of a highly diversified funding stream, so individual folks like you make up the largest base of our donors. We also receive funding, as you might imagine, from corporations, foundations, major donors, and others. But again, it's all free, and we want to make sure that there's no barrier to accessing good food for those who need it in New York City. There's about 1.4 million New Yorkers who are food insecure and face hunger. Last year, the soup kitchens and pantries that we serve helped provide food to about 5.5 million residents in New York City age 50 plus. And they're generally speaking about 1.4 million New Yorkers who are currently age 60 and older. And chew on this for a minute, by 2030, that number is supposedly going to rise to about 1.8 million, making seniors roughly 20% of the New York City population. So hunger, as you can imagine, remains a serious problem in New York City, and it's gotten increasingly complicated. Before I get into that a bit, just a little bit, everybody likes to tout themselves. So for the 6th straight year, City Harvest has received a 4-star rating from Charity Navigator, which is America's largest independent charity evaluator. We have 160 folks on staff, and we receive the kindness of more than 20,000 individual volunteers throughout the year to do the great work that we do. So a bit more context, talking about the hunger-obesity paradox. Uniquely in New York City, about 1 out of 10 immigrants in the nation live in our city. They make up about 46% of New York City's senior population. And immigrant seniors, as you might imagine, have lower incomes than their native-born counterparts. and much less typically in retirement savings. What you see on the map in front of you are target programming neighborhoods and some data about them. Across the country, we generally know that emergency food, which was originally intended to be used only in times of, well, emergencies, is now needed on a regular basis. So it's really a misnomer to call it emergency food. We've talked about over the last day or so that seniors struggle with hardships such as low fixed incomes. In New York, we've got extremely high housing costs, higher rates of serious health conditions, and generally speaking, lower participation in SNAP, which we've also talked about, that contribute to their long-term reliance on emergency food. 1 in 5 seniors in New York City lives below the federal poverty line, and a similar number receive food from our soup kitchens and food pantries, of which there are about 1,200 in total across the 5 boroughs that make up the city. In communities, and you can see that here, where we know poverty is high, the disease rates are also pretty typically high. And we know from New York City Department of Health findings that healthy, affordable food is hard to find. We've heard a bit about that this morning. Farmers markets, supermarkets, sources of fresh, healthy food are typically scarce and unfortunately vastly outnumbered by fast food places and poorly stocked corner stores, or what we lovingly call bodegas in New York City. There's abundance of heavily marketed processed food that's cheap, highly caloric, unfortunately convenient, but low in nutritional value. This is the new normal. It's been going on for a while, but it's our new normal in New York City. It's the hunger obesity paradox, and it's required City Harvest to really take an evolution in how we're doing our programming. So let's take a look at that. So our Healthy Neighborhoods program, the vision for our Healthy Neighborhoods program is that food is available, affordable, and in high demand. It's a 4-year program. We're in the 4th year of our program and strategic plan for this initiative now. It takes place in 5 communities across New York City, the ones that you just saw on the map. So for those of you who are somewhat familiar with the city, it's the South Bronx, which has the poorest congressional district in the United States, the North Shore of Staten Island, parts of Queens, Washington Heights, Inwood. It's a neighborhood in Upper Manhattan. And it's built really as an expansion, as you might gather, of the work that we started back in the early 1980s in rescuing and delivering food. We realize at City Harvest that it's going to take a long-term approach, right, to hunger and to ensure that we've got a lasting impact. We integrate our programming, so we want to combine it in areas that people are purchasing or consuming food, like bringing nutrition education, for example, right into supermarkets or right to the bodega. Our work is, in part on the retail side, doing makeovers of supermarket produce departments. So I'll tell you about that in just a bit. But for seniors at supermarkets, we're offering free in-store tours. It's conducted with a volunteer registered dietitian, and we'll have a small group of seniors, typically N equals about 10 to 15 senior folks in the store. We'll tour them around, we'll talk to them about how to eat well on a limited budget, how to read food labels, and then we give them a $10 challenge, and we ask them to make a meal for a small family on $10, and then we look at the market basket and evaluate what they bring back, and that's always a super fun thing to do. And we discussed how seniors can leverage pre-cut items in the grocery store. So, for example, a whole butternut squash can be a challenge for anybody to cook. I know that I have difficulty when I take it home, and I don't have a sharp knife, and it's tough to cut into, much less think about, how I'm going to cook it. So for seniors, we actually encourage them to take advantage of those pre-cut items in the stores. It won't go unused at home, and so spending a little bit more, for example, on that pre-cut product can make sense for a senior to ensure that they're eating well. We believe that the programs that we do will have a lasting change, and it's our hope that what we learn can be replicated in cities across the United States. And our goal is to share research that we did to design our programs, lessons that we're learning as we implement, and there are a lot of them, and what we're learning from our evaluations about our impact. So again, we work in an integrated way. Our first step is to ensure that we're bringing, as you see here to the left, good emergency food. We do that to food pantries and soup kitchens. We also, a la Alabama, have something called our mobile markets. It is a free, fresh air, open distribution, farmers market style that we do in conjunction with New York City Housing Authority sites throughout New York City. We do it 18 times a month. Each event takes place about 3 hours. We'll bring 15,000 to 20,000 pounds of fresh produce, 3 to 4 different varieties. It is a predominantly senior client base that we're distributing that produce to. It's a really unique way to also talk to them how to eat well, so we partner in cooking demonstrations. We have a Ask the Doctor table, so Montefiore Hospital, among some of our other health partners, are often present at the mobile market. A lot of these folks are their clinic clients. It's a more casual, comfortable way for them to entertain conversation about disease management, asthma, diabetes, heart disease, and the like. And then secondly, we know that people don't need free food all the time. So what you see to the right of emergency food here is that we want them to be able to purchase food for themselves. So we're again partnering with independent supermarkets, so smaller supermarkets in our space in New York City, and corner stores or bodegas to increase the variety of fresh produce that they're carrying. I'll tell you more about that in a sec. And then, as you've heard, we partner in nutrition education, right where people are making their choices, which gives them the best chance, we think, of incorporating nutritious food. And lastly, which I haven't talked about yet, but you see all the way to the right here, is that we tie our work into the community, because we know that with this connection, the investment in our work and from community members, rather, is really critical for its lasting impact and long-term success. So what are our desired outcomes? You see in front of you the 4-year plan to achieve our healthy neighborhood goals. So relieving food insecurity, improving access to healthy, affordable food, increasing awareness of healthy habits, and strengthening community capacity. All of these are anchored in some guiding principles that we have at City Harvest, which is we want to make sure that they're scalable, impacting a fairly significant number of people, that they're results-oriented, and that we're holding ourselves accountable for measuring our success, that they're collaborative, informed by any research, existing efforts, and what the community says that it needs, that they're fundable, integrated, and that the community, again, can be part of the solution. So I talked a bit about emergency food. We work to make it easy for seniors and others in New York City to be able to access free food. We deliver it, again, free of charge to a cadre of about 300 across the city community food programs, but in our target zones, it's about 74 programs. And along with the food, we typically like to deliver recipes to help recipients understand how to incorporate what we deliver in a healthy way, and familiarize them with foods that may not be, culturally relevant or familiar. An example is rutabaga. I often get asked, what is rutabaga? Or arugula, and forgive my language, but we often get asked, what's this spicy-ass lettuce? So we've got lots of questions, and we want to make sure we answer them appropriately. In addition to the food that goes to the food pantries and soup kitchens, I talked to you about our mobile markets. So improving the retail environment, what you see in front of you is a before and after shot of the work that we do in supermarkets. So this is an associated supermarket. It's a small independent chain throughout New York City. New York City doesn't have the same kind of built real estate environment that accommodates the larger big box supermarket chains that those of you that may live in suburbia or more rural areas are familiar with. So we have smaller supermarkets. We have staff who are trained in produce and in the retail space, and so we go in, we introduce ourselves to independent retailers, and we'll talk to them about merchandising. It's a 6 to 8 week program. We'll go in, we'll clean their infrastructure. You can see it was a little dirty before, and clean and well lit after, well marked. We'll provide them with shelf talkers and recipes. We talk to them about the benefits of cross-promotion, so yogurt, for example, with blueberries or strawberries in the supermarket. And then we do some follow-up work after what we know and why we work in this environment as City Harvest, because we often get asked, why are you doing this work? It's that 75% of food dollars are typically spent in the supermarket. And when supermarkets are overcrowded or non-existent, we work to connect folks with smaller local stores. We launched this program in about 2012. Our goal is to work with a little over 64 retailers in the area by the end of about 2017 to ensure their produce offerings are fresh, that it's affordable, that their stores are in places where residents could access them, and that where they'd like to spend their food budget. I talked to you about training their store managers. So again, merchandising, buying, assistance, and cross-promotion among some other things, all aimed, by the way, at doing what we call at City Harvest, increasing produce down the hatch, or generally increasing the consumption of fresh fruits and vegetables. The other piece is providing nutrition education. So we have free of charge, we offer multi-week nutrition education classes in our target communities. There's 6 to 8 week classes in New York City. We're the signature partner, for those of you that are familiar with Share Our Strengths Cooking Matters curriculum. It's a hands-on cooking and nutrition education curriculum. Shopping workshops, so those are the tours that I talked to you about earlier that we do in retail spaces. Cooking demonstrations, we'll do that at places where people are either buying or receiving free food. And the target audience is not only seniors, so children, families, and kids and parents paired together. And for seniors, we try and reach them at senior centers, community centers, wherever we can find them. We do have a claim to fame. We have a registered dietitian on staff who received an award this year. She is the Nutrition Educator of the Year here in the United States. Her name is Maggie Meehan. She developed a course at City Harvest called Well Seasoned. Kind of a cool and fun name for seniors. It's an 8-week course. It addresses the specific needs of seniors. So we take them through food safety, budgeting, physical activity that they can do, and so exercises that you can do while seated, exercises and fitness that's focused on better balance, how to purchase healthy on a limited budget, and again, how to read food labels. And then, of course, engaging with the community, as our gal from Alabama said just earlier, I cannot understate the critical importance of involving the community in what it is that you're doing. Our success depends on the people and organizations that reside in communities where we work. So before we enter these neighborhoods with programming, we conduct what we call a community food assessment that helps us understand the built environment and appreciate the existing assets and work of a community, and understanding the vision of where a community wants to go, how they want to do it, and some of the barriers for success. We convene what we call community action networks, or CANs, that provide a space for community organizations and residents to drive change in their neighborhoods. And we don't attempt to dictate or influence what it is that they're taking on. So some of these groups right now, they have heavy representation from retirees and seniors who always have amazing thoughts on what could happen in the neighborhood. They're working on community gardening, supermarket preservation in areas where supermarkets are closing, and other initiatives. And then finally, we're highly data-driven and outcomes-focused at City Harvest. We want to know, as I'm sure you would guess, that our programs are working, both at the individual level and the institutional level and the initiative level. So for example, we're asking ourselves questions like, are people actually changing their behaviors after our nutrition education programs? Are people shopping differently because of our work in the supermarkets? At the initiative level, we're interested in whether folks feel like they've got improved access to healthy food in their neighborhoods. Do all programs result in people eating more produce? On the evidence-based side, we want to both test our current programs and make sure that they result in the same positive outcomes year over year across our neighborhoods. And we want to continue to be, and we always have been, open to bringing on other programming that's already proven successful in other similar cities, so that we don't waste time on developing programs that might already exist. We've learned a lot in this programming. So partnership-based programming, we know, requires time and patience. Neighborhoods are each unique and dynamic. Community engagement is critical, as you've heard me say. Programming and messaging must be culturally sensitive. Anchor partners are key. Can't do it by ourselves. Cross-sector collaborations, as we heard just earlier, are super fruitful. And a consistent presence builds credibility. One of the ways that we were able to gain such terrific momentum and traction in our target zones was because we've been in the marketplace for 30 years. People see the green and white trucks from City Harvest crisscrossing the city. They know the good food that we're dropping off. And so they welcomed us warmly and openly, and that gave us a great advantage. And thinking about opportunities for additional programming in the future, some of the things that we're noodling on at City Harvest include potential retail pilot programs around using SNAP dollars to incentivize purchase of more nutritious foods. Different ways we're thinking about reaching seniors and consumers in general with nutrition information and disease management information. So we're thinking about, do we text them? How do we work on that? And then continued thinking about opportunities to engage consumers as change agents on the policy side and changing the built environment. These are communities where we often get told that it's just not safe to be out at certain hours to go shopping to the supermarket, or we don't have sidewalks or parks that we can go out and play in and take a healthy walk in. And so we're trying to partner with residents of these communities to think about how do we fit in healthy lifestyles and increased levels of fitness. I don't, apologies, have a next slide with my contact information, but I'm guessing that it's readily available from the planning committee here, and I'd be delighted to take any phone calls or emails in the future. Thanks very much again for having us.